Want to just give a real quick overview of California Advocates for Nursing Home Reform. I think most of you know what we do. That's one of the reasons why you're here. But we're a nonprofit organization. We cover California long-term care facilities. We advocate for the residents in those facilities. We advocate for better care, for compliance with the resident rights, and for just the good quality treatment of all seniors and people with disabilities. We're having a town hall today. I feel like I should be in a stool because that's what I think of when I think of town halls. But what I want to do is just explain what our format is. I'm going to go through a couple slides here. It's about 10 slides. And it's just to frame some issues, some common issues that we're seeing through our calls from consumers and their families and emails and all the news that we're hearing about. These are the things that we think that you might want to be talking about, that you're interested in, you may have questions about, and we're happy to try to answer them. The idea here, once I'm done with the slides, and I will go through them very quickly. This is not a webinar where I'm trying to teach you things. It's more of a conversation starter. So I'm going to frame the issues, and then I want to have a conversation. I'm trying to provoke a conversation. But I say that with a little bit of trepidation. We have to be very careful here. I'm desperately trying to avoid people consuming a lot of time with a really long story or a long question. Let's try to be very brief and right to the point, and try to generalize your questions as much as you can. I know that a lot of you are going to have questions that are very specific to your experience, and I invite you to share that. But try to generalize it so that other people will benefit from the answers. And besides raising questions and talking about what's not working, I think it is just as important, maybe even more important, to share experiences that worked. If you've got any examples of good care, if you've got any examples of advocacy that you did that was successful, we would love to hear about that. There's going to be a couple of CANHR staff members who answer the questions. It's going to be myself, Pat McGinnis, our executive director, and Mike Connors, one of our staff advocates, is also going to be on hand to answer questions. So it's a pretty good brain trust of information. All right, I think that's it for the preliminaries. Oh, two other preliminary things. One, I wanted to thank the Ombudsman, the State Ombudsman Office, for rescheduling their weekly team meeting. I understand they have it at this time usually, but they rescheduled so that a lot of the ombudsmen could participate in this town hall, which is very much appreciated. And then this is really important for me to explain. We will not have great answers for a lot of the questions that you have. We will not be able to solve some of the problems you're having. It's been one of the most frustrating parts of this whole experience since March, has been our inability to use a lot of the tools that we normally use to get people good care. And it all derives almost entirely from our inability to actually go into facilities, to have other people go into facilities. And frankly, the regulators are tied up in a lot of ways. So it's been very, very difficult to get problems resolved in any sort of satisfactory way. I just want to get that out there up front, that we'll do the best we can to provide ideas and answers, and there will be some, but for a lot of them, we're just going to be basically sharing your frustration, unfortunately. All right, so we had a lot of questions, or some questions initially about, it seemed that there was some confusion about long-term care. So let me just give you a real quick 101 on long-term care. We're going to be talking about nursing homes, also known as skilled nursing facilities. Nursing homes are regulated by the State Department of Public Health. So we'll make some references to California DPH in these slides and in the discussion. Residential care facilities for the elderly, also called assisted living facilities, are under the purview or regulated by the Department of Social Services. And within the Department of Social Services, it's the Community Care Licensing Branch. We also call that CCL. Assisted living facilities also include for the most part, what are called memory care facilities. That's a business term, it's not a licensing term. So there may be some nursing homes that have memory care units or wards, but most of our experience with places that call themselves memory care are in assisted living and covered by the Department of Social Services. And then there's also, of course, continuing care retirement communities where you may have a nursing home, assisted living, and an independent living unit all in one building or on one campus. And CCRCs are covered also by the Department of Social Services and are governed by a lot of the same laws as residential care facilities for the elderly. Okay, so let's go through the slides real quick. The first one, I just want to let you know our website, we've created a specific website for COVID-related items, which is about 95% of what we've been working on since March. So most of the things that CANHR is up to are on this website. Let's see if I can advance the slide. Okay. All right, there we go. So these are the 7 things that I'm going to go through real quick: visitation, resident movement and activities, resident movement out the door and evictions, and then what happens when COVID's in there, getting information, which has been a real problem for a lot of people with loved ones in facilities. A real quick slide about immunity, and then what to do mostly about filing complaints. Okay, so with visitation, this has been one of the hot topics of concern. We're certainly getting a lot of calls and emails about it. For nursing homes, outdoor visitation is mandatory. There is a state all-facility letter that requires facilities to accommodate outdoor visits between residents and loved ones. There are conditions for that. They have to be socially distanced. They have to be scheduled. The visitor and the person being visited have to wear masks. But other than that, as long as a facility has some outdoor space available to it, they've got to utilize it for outdoor visits. Now that could be superseded by a local public health order, which is the case in some communities, most notably San Francisco right now for the time being. We're working on that. But we know that a lot of facilities are not accommodating outdoor visits. We know this. So I expect that you will have questions about it and what to do, and we've got some discussion points about that. The status of visitation is summarized on our fact sheet. There's a link to it right there. I would definitely encourage you to take a look at it. We tried to do our very best to simplify all the different rules related to nursing home visits and assisted living visits, but we're still getting lots of concerns about it. Sorry, I'm having a lag on my advancing the slides. Okay, resident outings and activities. Boy, that's taking a long time. So outings are still a big problem. We've heard different things from different people. Facilities are kind of doing things on their own. They're developing their own policies and procedures. And one of our pieces of advice for you is to definitely ask for, if you've not received them, the facility's written policies related to visitation and going on outings. I've heard from different nursing home staff that it really depends on what the outing is as to how they're going to respond to the return of the resident. If the resident's going to is sort of on a controlled outing where one person is transporting them to, let's say, a doctor's visit where their only interaction with another person is with the physician, then they're not requiring a quarantine upon return. But if they're going out into the community at large and there's not a lot of control over who they have interactions with, then they are requiring a quarantine upon return. We had one really ugly case where a nursing home resident went for a walk outside of the building onto the sidewalk and then, around the block kind of thing. And when he came back, the facility said that he had been evicted and had packed up his stuff. It required a lot of intervention, but eventually the facility did readmit him, although they put him in a 14-day, very strict quarantine. That was a situation where the facility had not communicated anything in writing related to their policies on outings. For activities, this has come up a lot too. The requirements to have activities, individualized activities, and keeping residents engaged have certainly not been suspended. I think there should be more emphasis than ever on the part of these facilities to provide engaging opportunities for the residents to stay active and keep their minds busy and not bored. But we've been hearing a lot of the opposite, that activities have been basically furloughed and the residents are completely bored. Okay, that's backwards. That's backwards. Sorry, I'm not able to see. Okay, let's try. Okay, there we are. All right, exiting and entering. Oh, we've seen a lot of bad discharges going on. There was, I guess there was probably a 2-month period where it seemed to be the discharge problems that we normally see were muted, but they've sort of come back with a vengeance. We've seen a lot of residents being moved out of nursing homes to cohort them. This happens among large chains where one facility is designated as the COVID-19 unit or building in that chain, and they're moving people from the other buildings in that chain to the one that accepts COVID-19 residents or specializes in COVID-19. And then we're getting, more of the same kinds of discharges that we've always gotten, moving people out when their Medicare days are up, sending them to the hospital and refusing to readmit them sometimes based on COVID tests. We've even seen situations where people were dumped in hospitals and refused readmission because they were COVID negative, because the nursing home had decided that they wanted to focus on COVID-19 positive residents. We still have the statewide moratorium on evictions. That's important to know. It's important to emphasize to all the facilities that the normal legal process for throwing someone out of the building with the sheriff is not available to them. So they're really trying some other underhanded kinds of things. We're also hearing problems with admissions. A lot of nursing homes are reluctant to take people from hospitals, even with negative tests in some cases. So there's a lot of pressure being brought to bear on families from hospitals that, hey, you got to take them home because there's no long-term care facility that will accept them, even if they came from a long-term care facility. The short advice on that is to just refuse. I mean, hospitals are very expert at pressuring families into accepting what we would consider an inappropriate discharge location. So just dig your heels in and don't accept it. And it's best to put that stuff in writing if you can. Okay, I'm trying to advance the slide again, but that's not working. All right, the next slide was about COVID in the building. And this is really about what do you do if you find out the facility your loved one is in, or the facility you're in has COVID in there, or you suspect that they do and they're not saying anything. This is a very difficult situation, obviously. I think the most important thing to do is to engage the leadership of the regulatory agency. So for nursing homes, this would be the Department of Public Health. For assisted living facilities or CCRC's memory care, this would be the Department of Social Services. I think you want to write to get Sacramento leadership involved in the fact that you're very concerned about this facility being overmatched, overwhelmed, and unable to deal with COVID-19 in the building. The state has resources. They might not be the best resources, but they do have additional resources they can bring to facilities that are in trouble. They have strike teams that they're using. I would also strongly encourage you to get the local public health authorities involved and local public officials, the mayor's office, the city attorney's office, city council members, board of supervisors at the county level. They are very concerned about what's happening in a lot of places. They're very concerned about what's happening in long-term care facilities, and they're doing their very best to try to help people out with concerns. So I definitely get them involved. And another suggestion is media. We've never seen this level of media interest in long-term care ever. So local news reporters on television, radio, newspapers, they're all interested. Well, many of them are very interested in long-term care stories. So just reaching out with a compelling story, I think might get you some coverage, definitely get you some interest and response. My next slide is about getting information. And here's what I wrote. Do not accept poor communication. Document, mean write down. So important to write this stuff down. Write down your frustrations and requests for improvements. And then I also put a note in here about the formation of family councils. There's really strong state laws for both assisted living and nursing homes to facilitate the creation and the sustenance of family councils. And in this situation where family members can't meet together, I think the facilities have to go above and beyond and actually share emails. So if you have if you send the administration or management of your facility an email saying, I would like to form a family council or reach out with other family members so that we can share information with those that are interested, please forward this notice of interest to all of the email addresses that you have for the residents and their representatives in this facility. I think the facility has to accommodate that at this point. Because normally you would use a bulletin board or a mailer for that purpose, but in this situation you can't do that. There's no ability to use the physical premise. So send emails and join together and reach out to one another. I think that's really important. My next slide was on immunity. Just one sentence. There's this horrible immunity bill that's in front of Congress that would basically federalize all personal injury lawsuits against providers, no matter how bad they behaved during the COVID-19. It gives them a 5-year bubble. I've called it open season on residents. It's a really terrible bill. It's a piece of work. This is in Congress right now, and the best way to help oppose that, I'm gonna try to put an alert together on how to oppose it, but the Consumer Voice, that's a national organization that does a lot of long-term care advocacy like we do in California, theconsumervoice.org. So if you go to theconsumervoice.org, right on their front page is a bunch of information about this immunity bill pending in front of Congress and what you can do to oppose it, including signing onto a petition. And then my last slide was about what to do. And this is mostly about complaints. And we want to let you know that complaints are still very viable and important. They're being handled differently than they were before the pandemic, but they weren't particularly handled well prior to the pandemic either. So make sure that you file your complaints in writing. So many people call in their complaints. Don't do that. We've heard from so many people that they call in a complaint and we think that the person on the other end of the phone just takes the complaint and throws it away. So make sure that you have a written record of your complaint. I had some links for you, but for Department of Public Health, if you go to the website, Cal Health Find, that's one word, CAL Health Find, you can file a complaint against a nursing home. It's right there on the first page. There's a big box that says file a complaint. For assisted living facilities, you have to send in an email. And here's the email address. Let us know, LETUSNO, LETUSNO at dss.ca.gov. So it's let us know at dss.ca.gov. We're recommending people follow up on their complaints within days. If 2 days go by after you file your complaint and you've not heard anything, then follow up. Call the local office of the Department of Social Services or Department of Public Health and find out what's happening. If you do get some contact or you follow up and they say that they've opened the investigation and you don't hear for another several days, follow up again. You've got to stay on top of them. It helps if your complaint has what we call an immediate jeopardy angle to it. So if there's something emergent, there's an emergency with the health and safety of any of the residents that you're concerned about or the residents in the building, make sure that you emphasize that. And that should hopefully pick up the pace of the investigation. If you don't get anywhere with your complaint, if you're dissatisfied with the outcome or you think there's inappropriate delays, let CANHR know. And you also may want to let the media know. I think the media is a very important resource, has been a very important resource for improving long-term care since the pandemic. And that's all I have for the slides. Pat, Mike, do you want to add anything?
I was just telling everyone in the chat that I'll be emailing out a link to the slides as well as this recording later today. So it'll all be available to see.
Oh, that's helpful. Thanks. Pat, Mike, did you want to add anything?
No, I'm good, Tony.
The framing?
Well, oh, there we are. Hi. I've had a lot of communication. We've had a number of questions about continuing care retirement communities, particularly since people pay a lot of money to live in those places. They're independent living, and they should not be restricted by the same visitations that apply to nursing homes or in assisted living facilities. And in fact, in one of the provider information notices, the department included the language, residents in continuing care retirement communities who live independently are generally exempt from testing requirements and visitation restrictions. Although they put that in there in bold, that hasn't necessarily been true, because some of the facilities are saying, well, if you leave, you're going to have to come back and you're going to have to quarantine for 14 days, even if you go to the store. People are saying, well, I could have stayed home and not sold my house before I moved in here, and then I could do anything I wanted. So why this? One of the things that they made clear in an email recently was that if you ask for outdoor visitation and you are a CCRC resident, you live independently, they have to provide you outdoor visitation, even if there's an outbreak in the facility. Because everybody has their own apartment. They're not cohorting with the other residents in a nursing home or residential care facility. And so if you are a resident of a CCRC or you have a family member who's a resident of a CCRC, they do not have to be tested. They do not have to abide by the other visitation for the RCFE or the nursing home. That's it.
That's a real important point. So if you have a loved one or you're in a CCRC and you have some restrictions that you don't think are good, let us know and we'll see what we can do to help. All right, with that, so are we going to use the raise your hand feature, Emil, for contributions now?
That works.
A chat room, isn't there?
There is the chat room, which is one way to ask a question for sure. But if you'd like
It's probably
to,
quicker to do raise your hand. So
yeah.
They can also unmute themselves,
Yeah,
actually.
you can unmute yourself. One of the questions is, do we know what Newsom is going to do regarding requests for immunity within California? It looks like he's not going to do anything. He was trying to leave it up to the legislature. The nursing home industry, the hospital association, the doctors, etc., most of the medical professional organizations sent a letter, when was this, early April, to the governor and asked the governor to grant immunity from any from civil, from administrative, from criminal penalties. The governor has done nothing. Some of you were involved in the press conference we held right after that, and a lot of other organizations joined in opposing that. And at this point, the governor's done nothing. I doubt very much if the legislature is going to do anything either. Any other comments on that, Tony?
I've been telling people that in California, the immunity issue is dead.
I think so too.
Yay!
And then somebody else asked, I've seen published COVID numbers for skilled nursing in my area. Where would I find those numbers for assisted living facilities?
It's available on the DSS website. I don't know the webpage right offhand. Maybe Pauline or Emil could find it and post it.
You have that on our website, don't you, Emil? For the assisted living?
yes.
We do.
Yeah, someone just sent me, they did some beautiful charts from that website
Yeah.
recently, showing me the numbers. It's the assisted living's going way up. And it's troublesome, and we're hearing reports now that the staff aren't wearing masks and the licensing's not too concerned about it, which is very troubling, and we'll follow up on that. I heard, so Benson, hey Benson, he wrote a question about outings linked to short staffing. I think what he's saying is that maybe some facilities are not accommodating outdoor visits because they say we don't have enough staff to work to get residents up and ready and then outside and then back into their room. That's crap. That's not consistent with what the law requires. The law requires reasonable accommodations here. And in the case of visitation, because it's such an important right, I'm giving a lot of elasticity to the term reasonable, meaning the facility has to really be bending over backwards to accommodate this stuff. And if their excuse is short staffing, see if you can get the facility to put that in writing, because that would be wonderful to send to us and to the media and to licensing, that they don't have the staff to meet the needs of the residents, because the needs of the residents include accommodating visitation, without a doubt.
I saw another question here. Someone asked, what if the resident is bedridden?
Oh yeah,
What if the resident is what?
bedridden. Yes, okay, so this is where we get into outdoor visitation leaves a lot to be desired. We totally understand that. It's not gonna be available to every resident. We've heard from a lot of family members that say, hey, 6 feet apart would be worse than not being there at all. Because I wanna hug, I wanna touch, I wanna kiss my loved one. We realize it's very imperfect. We're probably not going to get too far, though, on in-person visitation inside the building. We're working on that. I'm trying to be very generalized here. But so for people who are bedridden, if there's any way for them to get the resident outside, I mean, if they have some sort of if it's 100 degrees outside, it's 100 degrees, they can't go outside maybe. But if there's any way to safely get them outside, that's why there's an importance on these visits being scheduled. Maybe it's a regular thing on Wednesdays at 11 o'clock, you have this visit, and then the staff know that morning to be ready to get that person ready to go outside. So if it's a matter of getting the bed outside, then maybe that's what a facility has to do. Again, we're looking at what's reasonable here. If it's not reasonable, then you probably can't get that kind of visit. Although I would stress being creative with what you think what could be done.
Thank you. That was my question.
Oh, you're welcome. Does anybody want to ask a question verbally? I don't want to hear myself talking all the time.
It says, I'm concerned assisted living residents likely is charges for services not needed and are not being delivered. No one is watching now more than ever. Thoughts? That we've had complaints about that, about extra charges. Jody, do you want to address that? It would be regarding the admission agreement. They can't charge. And if they're going to increase your fees, they've got to give you 60-day notice. Is Jody there or no?
I am here.
Okay.
Yes, so it is correct that facilities cannot charge for services that are not specified in the admission agreement. Also, residents have the right to refuse services. So we've been hearing cases about facilities for residents who have left the facility, charging the resident to have a one-on-one person with them when they return to the facility, and other similar charges related to COVID. So you can refuse those services and the facility cannot charge you. If you're having trouble, if there are charges that aren't in the admission agreement, or if the facility is charging you for items that you've refused, you should refuse to pay them. You should put something in writing about why you're not paying them. We have a fact sheet that refers to all the different regulations about charges, and it's good to reference those in any written communication with the facility. And also, please feel free to call us and we can help walk you through the charges and the authority for not paying them.
Well, it says, I'm a care manager in LA and have clients who are paying a premium for structured activities. The ED says activities have not missed a beat, but activities is an activity packet, kind of like they give kids for preschool, I guess, shoved under the door and with word finding sheets downloaded from the internet. I would say that that's what Jody was talking about. You can refuse that and you do not have to pay that fee, right, Jody?
Absolutely, and also all services and fees need to be specified in the admission agreement. And I'm guessing when residents moved into the facilities were not anticipating COVID and don't have something in their admission agreements talking about, special activities and the charges for them. So I absolutely would refuse to pay those additional fees.
What are the options if a facility wants to increase the resident care costs because the resident is COVID positive? However, the facility staff are verified as the cause of the COVID through county tracers. Again, I don't think they can increase your fees, can they, Jody?
No,
No. Even if they're COVID positive, they cannot increase the fees. And that's something people have to learn, as Nancy Reagan used to say, just say no.
I have a question.
Yeah, go
This is
ahead.
Charmaine, yes. Can a facility charge for the room tray service once the pandemic hit and the state was requiring, everyone to stay in their rooms, and they're charging my client for room tray service to her room?
Is that in the admission agreement, that if you ask for room tray, some of them, the admission agreements say that if people want to have meals delivered to their rooms, they charge an extra, $3 a day or something like that. It depends on, in that case, I think, Jody, right? Depends on what the admission agreement says.
well, I'm guessing the admission agreement might specify that there's a charge associated with that service, but if the facility is requiring residents to receive tray service,
Yeah.
they should not have to pay an additional charge for that service.
I think that's a great issue.
Yes.
My instincts right away are to push back against that, the
Say
charge
no.
of that fee. That's through no fault of the resident or any of the residents in that building. My guess is that the reason why you would charge extra for tray service is because it's outside the ordinary way that they do food delivery, and therefore have to have specialized staff to deliver those meals. But when that's the only way you can deliver food, I think you probably get some benefits of economy of scale of doing food service that way, that where you wouldn't have these extraordinary services for hours or resources needed for that. I just think that's a way for the facility to charge more for services. That
Yeah,
really
oh yeah, and a lot of
beyond
facilities are
special.
doing that, whether they're what they call structured activities or meals. There's another question that says,
Wait, Pat, there's someone who has their hand up.
oh, I'm sorry, where?
Rhonda Aldrich, you're unmuted.
Yeah. What was my question? We kind of got wrapped up in the conversation. I'm trying to remember. I think we were going to ask you was something a little bit off topic about if anyone had any success getting video cameras installed in their loved ones or clients' rooms so that they're not relying on client or staff, especially if the client is incapable of communicating any problems, but the family member or the advocate has, or conservator rather, would have a direct line of sight through a video Wi-Fi to be able to observe the patient or the resident
Without sound.
without sound.
Yeah, so video is very interesting. It's been coming up a lot during the pandemic, and I think it gets to a lot of some of the concerns I've seen here in the chat room about how do I know that they're even doing these things that I'm paying for? So video would be an answer to a lot of that. And residents in both nursing homes and assisted living facilities absolutely have the right to record their own private space. Without the consent of the facility management or even roommates, as long as they can keep the roommate out of the shot. But that said, expect a lot of resistance here. And the big problem during the pandemic is how do you get the video installed without the facilitation of the facility itself? You're probably going to have the staff place the camera. I don't think they're going to allow a work person, an installer, to come in and do that. Unless you're, with a wonderful facility. So I think there's going to be a lot of trouble, actually implementing a video surveillance system during the pandemic, but it is a possibility.
Yeah, just to follow up on that, this is an issue we've been exploring for several months, and we actually talked to local police officer about what would happen if we just installed it ourselves, and that was before the pandemic hit. And his answer was their room, their property, and if the staff were to remove it, they would take a theft report and regard it as a criminal act. We still have gotten a lot of resistance. We've done some legal complaints on trying to have it established from DDS and regional center that this is permissible, but they won't come out and say that. The government and the provider have been very much against that, but we're pretty confident the law's on our side, but we've been restrained actually implementing it because of the pandemic.
Yeah, that's consistent with our experience. The right to video your own private space that you pay a lot of money for, or that the government pays a lot of money for on your behalf, you have, for the most part, control over that space and can certainly video record it, but the practical implementation, that's always been trouble. And there are a lot of proposals being discussed about codifying or detailing this right in the law.
There's a comment here that a challenge for these kinds of things is getting them set up. And if there's a problem, there's no tech support on the staff. And this is true for cell phones, for video conferences, for, FaceTime, all of that kind of stuff, where the facilities actually were able to get grants to pay for that stuff. I'm sure that they didn't tell the residents or the family members that, but nursing homes in California and around the country got millions and billions of dollars, in fact, in COVID financing. And one of the grants that they got from the state and CMS was for electronic devices to facilitate communication among family members and representatives. Not that they have, but just to provide you with that.
So that grant that you're talking about, is that to the actual providers, or is that to regional centers or other agencies to distribute?
It was to the
reimbursement?
providers. It was to the providers. Now, mind you, one of the problems with this kind of money is it's given to providers and they don't have to provide any accountability for what they do with the money. And that's one of the biggest problems that we have with all the money that providers get. So.
We have 3 more hands raised. Sean Madison.
Hi, everyone. Thank you so much. I have a 2-part question on the ombudsman. What was the rationale behind ombudsman not being allowed into skilled nursing facilities when, shredding companies are allowed and workers are allowed to work at 2 different facilities at a time? And the second part, are ombudsmen not allowed in buildings across the country? Was that a state call or was that a federal call? So that's a 3-parter now.
All right, who wants to be our ombudsman representative to take those questions? I know there's a lot of you on this call. I see you. You don't want me to answer it. Anybody?
If you're an ombudsman, you should unmute yourself.
Yeah,
Thank you.
unmute yourself, ombudsman. Get in here and talk. Karen.
I am a retired ombudsman.
I nominate
Everybody can hear
Karen
me out
Jones.
there.
Yeah, there's Karen. I see Karen.
I see Karen too. Karen, speak up for us.
Hi. So it is national. We are nationally, CMS banned us from being in nursing homes, and then the state ombudsman followed here in California, as well as pretty much every state ombudsman did for the residential facilities. The rationale was in March, everyone was in a panic, and they quit doing a lot of stuff that doesn't make any sense, especially 5 months later. And so here in California and in some states, ombudsmen are able to return to facilities, although CDPH, the Nursing Home Licensing Agency, still says if the facility has an outbreak of COVID, nobody can go in, including ombudsmen. And that's a CDPH thing, so we can't undo that. Some county health officers also have orders that say ombudsmen cannot be in buildings. It's very specific. Some have other types of restrictions on ombudsman services, and we are working very hard to get back into buildings. And here in California, it's still county by county. We have a procedure, we have a PPE training to do, because we cannot be the spread of or catch COVID when we're visiting with residents. It's incredibly important that we not be a vector. And I think there was a third question, but I think I've lost my train.
That covered it. Thank you. It just makes no sense. And you would think after the 5 months, they could reconsider that. And then, because it just, again, a shredder company is in the building. Why can't the ombudsman be there? So thanks.
Okay,
Karen,
Well, the frustration.
I think the third question was, is it federal or state? And I think you covered it. I think Sean threw that in as a last, oh yeah, that makes it 3. So you covered them all.
Next question is Carol Crooks. Carol?
Hi, I
My question was if people were getting charged for meals being taken to their rooms and then everyone had their meals taken to their rooms, could the person that was being charged for it challenge that?
Oh yeah, so let me take this because there's a lot of difficulty in asserting your rights to not be billed in this way. So what you would do is you just dispute the billing. When you get the invoice, say, I'm not paying for that, and send a check for the amount due, deducting the charge that you're disputing. But I've had so many residents and family members say, well, that sounds really easy for you, Chicatel, but I'm the one who's got to live here, and they're going to threaten to throw me out. If I don't pay this bill, I'm getting all these notices past due, and I've always paid my bills, and this is really troublesome for me. So I get that it can be difficult to assert that right. What's really nice and during the currency of the pandemic is that there's no way that the facility could throw you out. I mean, they wouldn't be able to legally do it anyway. I mean, they'd have to go get an authorization from a court, which they can't do right now. But even prior to the pandemic, they'd have to get an authorization from the court that you did in fact owe that money and that you didn't pay it, and now the sheriff will be able to come and get you out in the next 15 days. I just don't ever see that happening. I know that a lot of people feel threatened by that and eventually capitulate and pay the disputed bill. But I've had other people who held out and never paid it and were successful.
Can I interject?
So, I mean, you listen to their arguments. If they've got a great argument as to why you owe this and it's in your contract, and feel free to send us to let us know what your problem is and send us the contract. We'll take a look. But if you think their arguments are pretty strong, then maybe you pay it, or maybe you come to some sort of settlement agreement and you pay half or something.
Well,
For the most
particularly
part, I don't think you can
if
owe
they're
it.
charging the PPE for their staff, absolutely not. That is not something that's in the contract, and I think that that's outrageous that they would even think to do that.
Was that one of the questions?
Yeah.
Oh boy.
Kiwi.
Yeah, well,
The idea that because there's COVID in the building or a particular resident has COVID, should give them the ability to enhance their billing, I think is a bunch of crap.
Yeah.
They promise to take care of you through sickness and in health. So, it's completely foreseeable that a resident in an assisted living facility or a nursing home would get an illness and would require some special attention related to that illness. And unless the facility has some highly detailed admission agreement where there are charges specified for those situations, I don't think they can raise your fees for that.
Tony, one quick question. It says, how is end of life defined for the purposes of visiting, of securing visits for residents in memory support and hospice? Because that's something that's come up numerous times as well.
Yeah, so this let me just real quickly address indoor visitation. In nursing homes, there's an exception for compassionate care. It's not end of life, it's called compassionate care. And to me, that is a broader term, a broader concept than end of life. It certainly includes end of life. Unfortunately, there's no definition of this. We've been told by CMS, that's the federal agency that supervises or regulates nursing homes, that it should be a fairly broad concept where when residents are really suffering medically, their doctors and their nurses are noting that there's declines related to the isolation of the pandemic, they should be offered a compassionate care visit. And if that needs to be indoor, the State Department of Public Health has paved the way for that. So push, explain why it would be particularly compassionate to allow this person to visit. I also want to talk about the support person visit concept, which is encouraged in state policy, but not mandated. And I've had so many people tell me that the state encouraging nursing homes to do anything has meant nothing. They're not picking up on this encouragement. They're not allowing medically necessary visits or support person visits. But what are they? We know that they're medically necessary. What does that mean? The easiest way to define that is a doctor says it's medically necessary. So if you can get a healthcare professional to opine that your visits are particularly important for this person's health and well-being, that would go a long way to having them described as medically necessary. And there's other ways, there's other laws that compel support and accommodations in these cases. There's been some success in other states with civil rights complaints for violating disability discrimination laws by not allowing medically necessary visits. There's ways to do this. It's really hard and complicated, but I don't want people to think it's useless to try to push on medically necessary support person visits or compassionate care visits. Do the pushing, do it in writing, try to get us involved. We'll try to get the media involved. Nothing's really going to change unless we get a vaccine or unless we keep pushing.
So Tony and Pat, we have some more raised hands. Suzanne, go ahead. You're still muted.
Who'd you call on?
Suzanne Livers?
Can you hear me now?
There we go.
Yeah.
You talked at the beginning quite a bit about outside visitation. Can you describe exactly what that is? Is that through a screened window at 6 feet? Or is that two people sitting outside 6 feet apart, both with masks? Or could you describe all the particulars to the visitation?
Between
an independent living person in a facility and a memory care person in facility, their spouses.
From what the Department of Social Services put out, if the facility has a designated area outside allowing family members to visit, and then they can visit, again, wearing masks and maintaining adequate social distancing. And whether, in terms of the CCRC, none of this applies, according to the Department of Social Services, applies to CCRCs, i.e. testing and or visitation in terms of even outside, that they don't have to be outside. However, we had a complaint where they deferred to the County Department of Health, and that's one of the biggest problems. They wanted to visit, they wanted to go inside their mother's apartment, and the county said no because one staff person tested negative. And that's one of the problems and the confusion of this visitation. But most facilities, if a facility has an outside area, then they must allow outside visitation. Is that correct, you guys? Tony, Jody, Mike? That's my understanding.
Yeah, that's correct. Now, there may be local orders that don't allow for this, and I'll bring up San Francisco again because it's very clear that it doesn't. But there's no way that an outdoor visit that's scheduled, that's socially distanced and masked should be prohibited by any facility, by any local public health authority. It's ridiculous. So that's what I'm covering in my discussion of outdoor visits. Scheduled so that the staff can make the arrangements. The facility's going to have the space. I think there are some facilities that don't, but most of them do. And then socially distanced, at least 6 feet apart. I mean, if they want to make it 8 feet or 10 feet, I think that's okay, with masks. And in that situation, I think you've got very strong ammunition for demanding visitation. I know that a lot of people aren't getting it in those situations, but they definitely ought to be. Let me distinguish that from window visits. For me, a window visit is not an outdoor visit. A window visit is almost it's almost like a visit in a bubble. So you got the resident in the building with a window between him or her and the visitor who's at some distance. Probably the window's open, I hope, so that they can have a discussion. But if it's closed, then you're talking on the phone, but you can at least see each other. To me, window visits, if there's a local health order that prohibits window visits, I would love to know about it. The window visits are completely safe. They should be accommodated. What we're getting the resistance from on window visits is we don't have the staff to monitor the window visits. And understaffing, the inability to accommodate these sort of creative forms of visitation is no excuse. It's an admission by the facility that they're not performing what's required by them under the law to provide reasonable accommodations in these situations. The people in this town hall should not accept understaffing as an excuse for any of this creative visitation. I've seen in the chat box, they're not getting the iPad charged. so that I can talk to my loved one. They're cutting us off after 10 minutes. That should not be happening. And I know it is. So write this stuff down, keep a log, compile it, make your complaints, follow up on your complaints, and then get back to CANHR and talk to the media.
My second question is, if you have a loved one in a memory facility and that loved one is falling as often as 3 or 4 times a week, that you're required to hire at your own expense an aide to always be with them, or to be with them at least 4 hours a day to minimize the number of falls. Is that behavior of falling with dementia or Alzheimer's one of the conditions that one would expect if they to be covered if they're in a memory facility, or is that a behavior that it would be reasonable to charge the family additional expenses to have an aide with them to minimize the falls?
My response to that is that's a pretty, I think, fact-intense kind of scenario. I'd want to know more about the case. But generally speaking, we get a lot of questions pre-pandemic about imposing one-to-one supervision on residents. And for the most part, it is completely unbillable. They cannot require you to pay for the additional staff that are necessary because the staff that they have are inadequate to do the job.
Thank you very much.
Margaret Griffin has her hand up.
Hi, can you hear me?
Yes.
Yeah.
My question has to do with local county public health folks. And I know we always tend to direct our complaints to public health or social services. I'm just wondering if anyone out there has had experience in going to their county Department of Public Health when there's an issue, and what has happened as a result of that. Is that a viable alternative to just always getting maybe not the best reception from public health and social services?
Yeah, I'd be interested to know if anyone's had success there. I've been dealing with local public health authorities for the first time in the last few weeks, and my impression is that long-term care is not their world. They don't know it, they don't understand it, and they're screwing it all up.
I had some experience with this with the Yolo County health officer. We should make a distinction here between the health officer and the public health department. They may be the same, but they could be quite different. Health officers have extraordinary power. I talked to the previous one. They're being turned over lately pretty regularly because of a lot of conflict regarding their positions. But I got a great deal of satisfaction in talking from her and getting some advice from her. So I think they are useful, very useful. And in fact, they have extraordinary powers to tell us what to do and what we can't do.
Thank you.
You know, there's a couple of questions on here still about, it says LA DPH is not allowing outside visits, even socially distanced, masks and scheduled. San Francisco is not allowing outside visits. Still getting resistance for window visits, saying they need approval from corporate and local DPH. I don't think any of that is legal, and it's all against state policy. So San Francisco DPH order C19-03 prohibits SNFs from allowing outside visitation that is not necessary.
Yeah, let me mention, so San Francisco is revising their policy. I just wrote an email last night checking in on that. It's supposed to come out this week. Hopefully it will be more visitation friendly. LA, I'm having success in LA getting outdoor visits in the nursing homes there. I don't think there's a prohibition from the local public health authority. I think that they're telling facilities not to do it, but there's nothing in writing to that effect. And I'm having success with the state imposing outdoor visitation, enforcing the mandatory outdoor visitation in LA. So let me know about that. What else I want to say? I think that's it.
Yeah, I mean, none of that, all of that is against the state policies too. So I think that if you let us know when things like that happen, we can probably intervene and make it. They're always going to err on the side of caution. That's the thing with the Department of Public Health. It doesn't matter what county it's in. And one thing from BETSEDEC, we do advanced planning documents and we can do a window visit easily if we pass documents back and forth, but we need an ombudsman if it's a nursing facility. How can we do advanced planning going forward? This is essential now for people in such facilities.
Yeah, so that's a good question for the ombudsman. You would go accompany an attorney to witness an advanced healthcare directive if you could do it outside of the building, right? Can I get an amen?
Tony, this is Benson.
Hi, Benson.
Not inside the building, but at the doorway
Yeah.
of single floor skilled nursing, where there's a threshold, and how the ombudsman are outside with another witness and the resident is inside, and the instruction is to wipe down the pan and that kind of thing. So we're not, and for bedridden witnessing, the state ombudsman office has these rather complicated guidelines where it's done virtually. It's a temporary, there's a 90-day window, I think, but now that the pandemic is going longer than 90 days, I think the state office in Sacramento is revising those guidelines for virtual witnessing.
And Karen, you made a comment too.
Yeah, so actually with Tony's help when this all started, because we were worried about healthcare directives, it does require in a nursing home an ombudsman, and we weren't able to go in. So we, with Tony, we worked out the probate code 4711, which allows people residents in facilities, well, anyone, to designate a healthcare surrogate. It's only good for 60 days, and it doesn't let them sort of choose the other options that are really important to be included in a healthcare directive. Yes, you can renew it. And in fact, in my county here in San Luis Obispo, I sent a memo out on Monday to all the nursing homes reminding them that we're well past the initial 60-day period and they need to renew them.
Right.
We are trying to work out procedures now that in San Luis Obispo County we're going back into facilities on how to do a healthcare directive with as little contact as possible, but also making sure that these really are the residents' wishes and that there's no coercion, which is why we have that role. So I have to actually have an ombudsman who's going to come and we're going to try to, role play figuring out how we can do it as safely as possible with as least amount of kind of document turning back and forth. Again, we just don't want to be the vector. And a lot of our ombudsmen are of the same risk factors that a lot of our residents have. So we do not want ombudsmen to get ill either.
Yeah, thank you, Karen and Benson. So we're at 12:05. I say we go for another 5 minutes and then we call it a day. We do have another town hall in 2 weeks, Pauline, about financial scams, I think. So you can register for that too. We'll send out another alert about that. And I mean, we have a few more minutes, but I want to stress, call us, email us, go to our website, take a look at the information we have, follow along. Just make sure that you include us on if you're having problems. We're doing what we've always done, which is fight against all this stuff.
Can I say something real quick?
Sure.
Hi, my name is Elizabeth Malloy. I'm a geriatric care manager in LA, and most of us, there are a lot of us geriatric care managers who are in touch throughout this, just in general, we're all very collegial. And between us probably have clients in about 10 different communities in assisted living, and we're private pay. These are generally, people who can private pay and who can afford assisted living. And we have had some experiences with, the whole range. And I've had in mind like a professional letter from, the Aging Life Care Association, or from us just as individuals, kind of with a scorecard at the end of the day, because we're kind of seeing it from both the family's perspective and the residents, and we're visiting the residents to some extent, or taking them to doctor's appointments, and just really seeing it. And so I'm kind of fascinated by how this is unfolding, especially since the most expensive communities tend to be the most egregious in terms of what they're not communicating, and their fees. And so I find this invaluable, even though I know there's a kind of a bigger fight with like the SNFs and the nursing homes. It's just thank you for all the work you're doing.
Oh, thank you. And I think one correlation you may see with the more expensive high-end facilities being more on lockdown mode is because they're usually larger, right? So I think the small 6-bed assisted living facilities, for the most part, are business as usual because they're so small. But the larger facilities have to be, I think, more conservative. So, but they also should be very creative if you're paying high-end dollars. And we've heard all the complaints about activities. I participated in a training for licensees of the Department of Social Services on being creative with activities, and there was over 2,000 participants. So I know they're getting information about how to, and there was really great information about how you can keep the residents engaged. And I know a lot of facilities are trying, but we're still hearing reports that some aren't. I think the Department of Social Services would take a complaint like that pretty seriously, I would hope.
There have been a couple of suggestions that we do a follow-up town hall, and we probably will in about another month, just because by then we might have more adequate guidance from the Department of Social Services and the Department of Public Health. So we will certainly let you know.
Hey, Tony, this is Benson. One last question. Am I remembering correctly that one of these CCL pins waived the fingerprinting requirement for new employees in RCFEs, or was that not waived in terms of bringing in new caregivers during staff shortages? What's the guidance right now from CCL about that?
Vincent, I don't know. I know that, on the nursing home side, the training requirements were waived. On CCL, do you know, Mike or Pat?
Yeah, they did waive that. There is a PIN, a provider information notice that they sent out where they waived that. I think you're right, Benson. I'd have to go on our list of provider information notices and find that particular one, but they did because they wanted to ensure that they could get enough staff quickly.
That makes me really nervous.
Yeah.
Yeah, and let me also anticipate where some of you may go with that line of thinking, saying, well, so they can hire anybody off the street that can come into the facility 5 days a week and provide care to all these people, but I can't come and visit my loved one who and that there was a news story about a woman who got a job so that at a facility washing dishes so she could visit her husband. It points out all of the problems with the visitation policy that we have, that, it's easier to get a job and go into a nursing home and take care of 20 people and see your loved one that way than it is to just go see them in a very scheduled and safe, controlled way. So, we're very concerned about the waiver of the requirements too. And how long is it going to last? I mean, this has been months and months.
Mm-hmm.
At this point, up to a third of all the staff people in California in long-term care facilities may have not had the training and the background checks that we use to stay safe.
I have two very quick questions. One is a question of terminology. Is there a term that applies to all of these units? Something like long-term care or whatever?
Yeah, we call them long-term care facilities.
Long-term care. My second question is, I think I heard this, but can I get confirmation of this? That in the case of units within a CCR, like a memory support unit within a CCR, the major regulatory power is the Department of Social Services, not the State Department of Public Health. Is that correct?
That's correct, because usually there's not a license for memory care. All CCRCs are licensed as residential care facilities for the elderly. If they have a skilled nursing unit, they get a license from the Department of Public Health. But generally, if there's a memory care unit, there's no license for that. It's just something they made up for advertising or whatever. It's now become common. Be called, we have a memory care unit. Well, big deal. They did before too, only they didn't call it memory care. They called it residential care or assisted living. So, but they're usually part of the residential care facility assisted living, and that's under the Department of Social Services.
So they're lumped in with assisted living in a CCR?
Yeah, yes.
Okay, thank you.
All right, you're welcome, and thank you everyone for participating.
Good job.
Thank you.
Thank you.
We will have more of these. As much as it's difficult to talk about these things and all of our frustration, it was really energizing to see a lot of your faces today. I miss some of you so much.